Hi, and welcome to the City of Lubbock COVID-19 News Conference. Today we'll have updates and new details from the Health Department with Catherine Wells, our Director of Public Health, Local Health Authority, Dr. Ron Cook, and Lubbock District 4 City Council Member, Steve Massengale. So let's get started with Catherine Wells.
Good morning. Thank you everyone for being here today. It's been 2 weeks now since I've had the opportunity to address you all. And I'm going to give you an update on our current numbers and then talk about some of the trends we're seeing here in Lubbock. The Health Department is reporting nearly 12,000 cases of COVID-19, 11,952 to be exact. We have also unfortunately seen over 129 deaths now associated with COVID, and we have also reported over 9,000 recoveries. It has now become the norm for us to see 100 cases a day, and we've even seen multiple days nearing nearly 300 cases. This daily case count number is similar to what they're seeing in large metropolitan areas. It is very high for Lubbock. The number of hospitalizations is also increasing, with 93 individuals currently hospitalized. The number of patients in the hospital is also rising throughout the region, and we need to make sure that we have capacity for all of West Texas. We need to do more to control the spread, and that really means getting back to basics. These are the things we've been talking about for months now. Wearing your mask, washing your hands, staying home if you're sick, and maintaining your distance, which includes limiting the number of people you come into close contact with. High case numbers mean that we have uncontrolled community spread, and this means that we are now seeing more cases in our vulnerable populations. In Lubbock, the first outbreaks were in our nursing homes. These facilities have done really well over the last 5 months, but once again, we are seeing cases. The Health Department is currently monitoring 6 facilities for the potential of having a larger outbreak. The governor recently opened nursing homes to visitors, but those homes that have cases are going to be unable to reopen. These cases are preventing families and loved ones from visiting those relatives that they haven't seen for such a long time. The Health Department has also identified outbreaks in distribution facilities and offices. These outbreaks are preventable. If masks were worn properly, the spread could have been reduced. Remember, masking is just as important at work as it is in the store. If you are not sitting in a private office, you should be wearing a mask. If someone enters your office, you both need to put that mask on. For masking to be effective, everyone needs to wear one and wear it properly. That means covering both your nose and your mouth. The mask is not effective if it's under your chin. We are also seeing workplace exposures tied to break rooms where groups can gather. Eating and mingling in close proximity are also associated with group spread. Everybody might be wearing a mask when they're out on the floor and working, but remember, it's just as important that we look for these other high-risk activities in our work environment. I encourage employers to look through their workspace to see if there's any places that you could have potential exposure and do things now to mitigate them before you have cases in your facility. The last thing I want to highlight is travel. We're seeing lots of individuals traveling and have seen some large groups where 6, 10, 20 people are infected or exposed because they all went on a trip together. When you go out and if you travel outside of town, remember that social distancing. Remember to limit the number of people that you're spending close time with without wearing a mask. With that, I'm going to pass it over to Dr. Cook.
Thank you, Catherine. I just want to reiterate that Catherine said, and I want to begin with the same message and I want to end with the same message. We must wear your mask. We must socially distance and we must wash our hands. And I want to speak very frankly with you now and with all serious tone. Our numbers in Lubbock, our positive cases are really exploding. Our hospital ICUs are at or near capacity. And it's clearly evident that we're not doing a good job with wearing our masks and social distancing. Our governor has opened up our businesses here in Lubbock and the state to 75%. That does not mean that we're 75% over this virus. We are a long ways away from being over this virus. Certainly not 75%, not even 50%. These exploding numbers are not just from our college-age community members. It is now clearly evident that we have community spread in our schools, in our nursing homes, and also other businesses. And this comes from the laxity in our not abiding by those things that prevent this disease. Those things that are right in front of us. We have masks, we have social distancing, and we have washing our hands to help stop this virus. Most of our events, most of our infections are related to social events, like Catherine said, football games, soccer, softball games, tailgating, weddings, funerals, eating out, and just going to parties. All of these places are where we let our guard down and we're not wearing our masks, we're not social distancing, and we're certainly not washing our hands. The norm should be now that if you're in that situation and somebody is too close to you and somebody's not wearing a mask around you, it should make you uncomfortable. This is how we must stop the virus. I have another concern, and that's winter is coming. I know that's a popular phrase, but winter is coming. And because winter is coming, it's going to force people inside, closer together, increasing the risk of spreading disease when we're not doing the things that we should be doing, like wearing our mask and social distancing. All the more reason to make sure that we get in the habit now with wearing our mask and social distancing. If we don't do these things, Lubbockites, we could easily double the number of cases and easily double the number of deaths that we have here in Lubbock if we don't wear our masks and we don't socially distance. Just not long ago, the United States passed 200,000 deaths related to COVID. That is the size of Lubbock. Lubbock's wiped off the map. 200,000 people, pardon me, have died from this. That's the size of Lubbock. Over 2 million people worldwide. No other pandemic, no other disease has caused that kind of death and that kind of illness in this short amount of time. These are historical times. These are times that we're going to have to learn to live with, wearing a mask and social distancing and being uncomfortable when people are in your 6-foot bubble and not wearing a mask. And by the way, this is not going to go away November 3rd. And we're not rounding the corner. We're not getting any better. And the vaccine is not going to be here by November 3rd. It might be here, some of the earliest ones, maybe by early summer. It is also estimated that 85% of Americans, why don't we just say 85 to 90% of Lubbockites are still vulnerable to the COVID virus. Herd immunity is not going to happen anytime soon. The good news is we can stop this. This is what we can do. We don't need to be afraid of this virus. We don't need to be cooped up, but we must be respectful of this virus. We can slow it down by doing those things that we've talked about over and over. And we need to continue to talk about those until we're comfortable, till you're comfortable wearing a mask anytime somebody is within 6 feet of you, and make sure you keep them, do your best to keep them at 6 feet away from you, and washing our hands. We have plenty of room in West Texas to keep people at a distance from each other and to wear face masks. So those 3 things, actually 4, social distancing, wearing your facial covering, getting the flu shot, that's the 4th one, and then the 3rd one is washing our hands. People, we can do this. Lubbockites, we're a good people. We can do this. get your flu shot, wear your facial coverings, wash your hands, and stay socially distanced. I'm going to hand this off to Councilman Mr. Massengale.
Thank you, Dr. Cook. Good morning, everybody. Mayor Pope sends his regrets. He had a conflict and he's unable to be here today. Before I get started, on behalf of the mayor and the council, just let me extend our sympathies to any family that has been impacted by the coronavirus, and especially any business that has been negatively impacted. So I'm going to start this morning with the data. I think there's some important things for us to see. Let me get my screen shared here. Okay, get my slide where I want to do. So this is the slide that you're used to seeing. It's our positivity rate. And you can see that we're trending in a direction we don't want to be. We can't get off of that 18% range. And so this is concerning to us right here. The next slide is our hospitalized patients that have COVID-19. Again, the trend here certainly has our attention as we see that these numbers are climbing. This slide is a slide that I shared with you 2 weeks ago. Thankfully, our schools are doing a great job, and I believe the data here show us that. This next slide on 18 to 25, I think, is best explained by this bar chart. And you'll notice that the 18 to 25 age group does not bear all the cases this time. We're seeing, as Ms. Wells and Dr. Cook has mentioned, the community spread, and that's why you see the cases in these other age groups growing. Okay, I'm going to share one more with you. So this is off our city website, the COVID dashboard, and this talks about our cases, and what we look at here is our known cases and our community spread cases. If it's a known case, that means we can trace from where that person got the coronavirus. When we have community spread and we see community spread growing at up to the same level as known case, that's concerning. We've got significant community spread in Lubbock right now. Okay. See if I can get back to normal here. Okay, I'm back. Okay, so my comments today are going to be very similar to what you've already heard, and that's mask fatigue. We know that the mask, the facial covering, is what protects us right now from the virus. Catherine shared some information about where we're seeing the spread in Lubbock. We've had a distribution facility that let their guard down in a break room, and we've got spread in that facility, and that's disruptive. That's disruptive to that business, and it's disruptive to those families. Where we're seeing spread, activities like bar hopping, we have parties, any type of gathering, group travel was mentioned. These are all high-risk activities. It's not okay not to wear a mask when you can't stay socially distanced. So the mask, this mask right here, is the one I've been wearing. And I got to wear it. I had to work at the game on Saturday. I wore my mask from 10:30 in the morning till 7:30 in the evening. I did not like wearing my mask, but I know it's the one thing that keeps me safe and everyone around me safe as I interact with them. Our goal here is twofold. We're trying to protect our hospital capacity, as Dr. Cook said. As we enter the flu season, that becomes a bigger challenge. And so that's why, again, it's so important to wear your mask. Also, I would encourage everybody to get a flu shot. I think that helps us as we enter that season. We also wear masks to keep our most vulnerable safe. My parents are in their 70s. I don't want them getting COVID-19. I don't want to be the source of the spread. And I'm going to continue to wear my mask, and I hope you do too. So let me talk a little bit about Halloween. Tomorrow's going to be the 1st of October. And it's important that we're able to celebrate Halloween, and I think we can do that safely. We'll be releasing guidelines from our recovery task force on how we can do that safely as a community. Finally, I'm thankful that I live in Lubbock, Texas. I was watching the news this morning and watching states like New York continue to restrict activity, and they don't have kids in schools. And I just think we're lucky to be in West Texas. So let me share some economic data with you. It's a testament to how our economy is rebounding. We're one of only 6 cities in the Texas top 20 to be above prior year July sales tax. Our June sales tax collection is 10.3% above prior year. May was 2%. Our real estate economy is very robust right now. Building permits are almost 2 to 1 compared to last year. Now here's a very significant metric. Our unemployment rate is back down to 5.4% from 11%. Our economy has always rebounded well, regardless of the challenges it faces. And so I think that's a good sign. I think it's a sign that we reopened, and that we reopened safely. So again, I'm thankful that I live in Lubbock, Texas. So with that, I'll hand it back over to Lacey.
Thank you, Councilman. Okay, now we're going to open it up for our media questions. And today's media question order is Casey Ellingson with Texas Tech Public Media, Matt Dotre, the Lubbock Avalanche Journal, Brittany Michelson with Fox 34, Terry Furman, KLBK, Karen McKay, KCBD, Christy Martinez with Latino Lubbock, Matthew Stell with KMAC, Amanda Hampton, the Daily Toreador, and Olga Guerrero with El Editor. So let's get started with Casey Ellingson.
Hi, I'm curious regarding the COVID cases that have been transferred to Lubbock. Where are those coming from, and why are they coming to Lubbock?
Dr. Cook, can you take that one? She's referring to cases that are transferring into the hospitals.
Oh, okay.
Yeah.
I'm sorry, Casey. So realize that we're a large regional medical acceptance center from around the region, from all the way up to Oklahoma, down to past the Permian Basin, and halfway between here and Dallas. We're also getting transfers from outside the trauma, what's called the trauma service area, that region I sort of just described. And so they, in their own communities, they may be full, can't handle, or they need the expertise that we have, the medical expertise that we have here in our community, which is excellent. And so that's usually the biggest reason why we accept those, especially those patients that are significantly ill with COVID. They need a higher level of care, access to ventilators, long-term access to ventilators, and the expertise associated with that kind of care.
Mm-hmm. And in terms of the current hospitalized cases, are we seeing any tech students or college-age students who are currently hospitalized?
I don't have that data. There's most of the hospitalized are in the older adult population or those that have comorbid disease. But there are some of those individuals in that age group that would fit into that.
Okay, thank you.
Mm-hmm.
Now we have Matt Dotre with the Avalanche Journal.
Good morning, everyone.
Morning.
Dr. Cook, can you elaborate on, you said ICUs are nearing capacity. Can you kind of elaborate on what's going on at hospitals? Because, so the city's website says there's 42 patients in ICU. Isn't the most we've seen. So can you kind of elaborate on why hospitals now are reaching capacity, and are they taking any steps for overflow?
Yes, Matt, thank you. So these are the ICUs, not the regular hospital beds, but the ICUs are at or near capacity. Now that's more or less pre-COVID. Now we both hospitals that have the big ICUs here have surge capacities for COVID-related types of patients. And so now we work best, just like your car, it doesn't work best when you redline the car, when you redline your tachometer. Our hospital systems work best when we're below that red line. So we have the capability to take care of patients in overflow and surge, but that's not sustainable for long, long periods of time. And we're bumping up against that red line. We can do it. You can run at 10,000 RPMs, but you don't need to. We're sort of there. And remember, we don't just hospitalize COVID patients. We have trauma patients, we have post-operative patients, we have heart attacks, we have strokes, we have overwhelming infections, diabetics that go into diabetic ketoacidosis. We have all these other problems that need to be admitted to the ICU. And if we fill them up with COVID patients, it's harder for us to take care of everybody else that needs ICU capabilities. So we just need to be careful. We need to slow it down. The whole goal is not to make the virus go away, but to be able to handle those patients that need to be in the hospitals for our care. And if we get too carried away and we don't slow this down, our hospitals are going to be overwhelmed.
Absolutely. Okay, thank you. And Ms. Wells, I wanted to ask you about the nursing homes. You said there's outbreaks going on at 6 nursing homes in Lubbock. Did these outbreaks begin to occur after the state started allowing visitors? And I guess my question is if you think allowing visitors can be done safely.
We're really monitoring 6 for potential outbreaks, so we don't have, large scale outbreaks like we had early on. But we are watching those, and I really think it's from employees. I mean, we have individuals that we have a lot of virus circulating in the community that increases the likelihood of an individual that works there from being infected. And there's always that risk of bringing them in to those nursing homes.
Okay, so you're not seeing them with visitors. You're seeing
No, we've seen very few visitors so far into the nursing homes.
Okay. All right, that's it for me. Thank you.
Thank you, Matt. Now we have Brittany Michelson with Fox 34. Brittany, can you unmute yourself, please? Okay, we'll come back to her. So next we have Terry Furman with KOBK.
Good morning, everyone.
Good morning.
My question is this. Are we looking at this being our second wave per se, or are we still, kind of going off of what we were prior to possibly a second wave?
Well, to answer that question, we slowed down a little bit from our peak. I guess you can call it a third wave, or I hope we don't have a second wave. I hope we don't have a third wave. I fully expected this, and so we are prepared, fortunately, but we're going to be in trouble if we don't slow it down soon.
Agreed. Mr. Massengill, my next question is for you. You mentioned the social gatherings, whether it's softball, baseball, soccer for kids, that kind of stuff. Is there any way we can make those events safer to prevent, more community outbreak there?
You broke up. I think you asked if we could make those events safer to prevent. Is that correct?
Yes, sir. That's correct.
Okay. Thanks, Terry. If the outdoor events, they still come through the mayor's office and we approve those. We see some great plans. I would say that it's incumbent upon those operators to follow their plans. We've seen some events that they didn't follow their plans and we had problems, but I believe that those events can be conducted safely if they understand the strategies, the social distancing, the hand washing, sanitization, and most importantly, face coverings.
Yes, sir. Thank you.
You're welcome.
Okay. Thank you, Terry. Now we'll go back to Brittany Michelson.
Hi, sorry, my Zoom kept kicking me out. But now that we're several months into this, have there been any noticeable trends in people getting tested? And are there still plenty of sites for someone to go out and get a test?
Want to take that one, Catherine?
Yes, there's definitely plenty of sites to get tested. We are not at capacity at the walk-up clinic at Rogers Park or the drive-through clinic at Larry Combat Center. Every day there's been the ability to accept more people into those places. So there shouldn't be anything preventing people from getting tested. Definitely still see people, our testing numbers are up there. We still have very high testing per capita, which is a good thing.
All right, thank you. And I was wondering, how did social distancing work at the Hometown Heroes concert this past weekend? And is that an example of what concerts could look like for some time?
I'll take that one. I was not at the concert, but got reports about the concert. That concert had they really had a great plan. And, but we haven't had any reports of any issues from that concert. And yes, that could be an example of how to conduct outdoor events that size in the future.
Thank you.
At the concert, we got.
Okay, now we have Karen McKay with KCBD. Karen, can you unmute yourself, please?
Yes, I'm sorry. Can you hear me now?
Yes, ma'am.
I've missed you guys on Wednesdays. It's good to be back. I wanted to ask Dr. Cook, you mentioned no other disease has caused this amount of death in this amount of time, but a lot of people still argue that COVID is just like the flu. Can you hear me?
I can.
Okay. A lot of people still argue COVID is just like the flu. And as we head into flu season, can you keep a separate count of COVID deaths and flu deaths? I know in my first week of COVID, it was like the flu. And I'm happy for those people who do not continue with symptoms that progress after that. But for the sake of those who argue that it's the same thing, can you give us a count of flu deaths as well as COVID deaths as we go into the season?
We'd have to
really, so we can make a real comparison of the difference between the two.
Yes, we're able to do that, I think, but it would probably have to go through, it would be somewhat delayed because that's reported through the Bureau of Vital Statistics in the state and in the what we call the death registry, and filling out death certificates. And so there's a way to list that. It would require that the individual be tested both for flu and COVID if they were admitted for those things. Yes, it can be done. It's a little bit somewhat tedious to muddle through the data that way, but it can be reported. But we'd have to just go to the website, the Bureau of Vital Statistics website to monitor those there.
But here in Lubbock, do you think our deaths from COVID have already surpassed what we would see normally from the deaths from flu in a normal year?
Oh, yes. Yes.
Doesn't seem like it, have they?
Yes. Yes.
129.
But remember that flu we're just now starting the new flu season. If you look at the CDC website, we just finished the 1920 flu season, so we're just now starting the 2021 flu season. And so, but flu is just now hitting Lubbock. So that's my big recommendation. Everybody go get your flu shot. If you're over 65, you need the high dose flu. I don't like to say old, it's more mature and experienced individuals need the high dose flu shot.
Dr. Cook, do you know offhand though what the number was for flu deaths for last season so we can compare?
Oh, no, I do not. We might be able to sort through that.
And I'll just add something there, Karen. The challenge is that flu deaths aren't reportable. So we don't get real-time data. We have to go back and look at historic vital statistics data, whereas COVID deaths are reportable to the health department immediately. And that's why it's harder to make that comparison, but we can do a historical comparison.
Yeah.
Mhm. I'm not trying to make light of the COVID deaths. I appreciate that. I just wanted to see if we could have some sort of a comparison. So thank you.
Karen, we're glad you're better.
Thank you, Karen. Now we have Christy Martinez Garcia with Latina Lubbock.
Good afternoon, you guys. Hope you're doing great. How about that event last night? That was a lot of interesting politics, but just right. Just like all this discussion, you have two sides. People have started to feel that this is how COVID information is getting to them. It's very inconsistent. You have one group saying one thing, another group saying the other. And I hate to say it, but even, I'm hearing the numbers, I'm hearing the precautions to take on how to prevent COVID, but then I'm hearing Steve talk about the economics of this. So Steve, this question is directed to you. Would you say that livelihoods are more important than lives?
No, I think we have to work to strike a balance there. And I don't think the economic data indicates that we've overcome COVID-19 challenge. I think it indicates that we're learning to manage and to get our businesses open and get people back to work while managing through the coronavirus.
I'm a small business person too, so I get it. I want to see thriving businesses, but not at the compromise of lives. And I've had a lot of people ask, considering all the COVID fatigue and all the COVID, the mass fatigue and whatnot, why are we not doing press conferences weekly? That's the other question that I have. But something that I think is even more important is, now that the Lubbock County has lifted their declaration, is the city going to follow suit? I mean, considering that we're still dealing with more deaths and more COVID issues?
I'm sorry, I lost quite a bit of your audio there, Christy, but I think your question is referring to the county's emergency declaration and whether or not we're going to lift ours. Is that correct?
That's correct.
We don't anticipate that. Keep in mind that we're still all under the governor's order, including the county. And the governor is what has dictated the restrictions to this point. We're no more restrictive than what is in his order.
But do you think he's aware of what's happening with our numbers in Lubbock? Because it doesn't seem like he's.
Yeah. The governor is aware of the numbers, but let me finish my answer. That it is important for us to continue to have that emergency declaration in place, because the way the federal government has set up some of the reimbursement for us, we have to have it in place to continue to get the reimbursement as a city for the expenses that we've incurred related to the coronavirus. Now, the governor's reassured us, and we stay in good communication. The mayor specifically stays in good communication with the governor's office, and they are aware of what's going on out here. And if there's a time that we need additional support for them, we're prepared to ask for it.
What about the press conferences? There's been a lot of concern that, and it's not some, I think people just want information. They want to feel like they're in the know. So are you going to increase, considering our numbers are increasing, or are you experiencing COVID fatigue as well?
No, I don't think it's COVID fatigue. I think we're committed to sharing information with y'all when we have new information. If there's a need to have a press conference in between this 2-week routine that we've committed to right now, we'll do that. But I don't see a need to do that right now.
I beg to differ, but thank you for your time.
Thanks, Christy.
Christy, it's Dr. Cook. Can I add a comment here?
Please.
We all have COVID fatigue, but we must continue to fight. And the 5 of us can get up here and talk all the time. And I think people at times, just like we get tired of listening to our parents talk to us, So we need, those of us in the health community and the city leaders need other people in the community to continue to push this word out amongst their peers. Because Christy, you have peers that will believe you more than what I say. So I need everybody here listening to continue to push this word out and be the expert in your own circles, in your own communities.
I think that there's no doubt that the media is definitely doing that. And then us as a bilingual media are also following suit, but we've got to have accurate information. And that's why we depend on you. And I think that's why they depend on us. So it kind of trickles down. So just, something to think about.
Thanks, Christy.
Thank you.
Thank you, Christy. Now we have Matthew Stell with KMAC News.
Thanks, Lacey. Two quick questions. The first one is for Catherine Wells. Catherine, you mentioned that, of course, with these numbers going up, that a lot of it has been linked to community exposure. Has there been any major exposure locations throughout the city that we should know about?
The hard part now with the contact tracing and investigations, it really ties back to workplaces and general social gatherings. So we've been able to contact people that have been exposed. We're just seeing more and more of these gatherings. I mean, because we're opening up doesn't mean that we should let our guard down. We still need to be mindful about masking and limiting those social interactions as much as possible so that we can all go out and enjoy stores and restaurants and some of the things that we have the benefit of having open here in Lubbock.
Gotcha. So there's no one or two stores or restaurants that a lot of these cases are being traced back to, right?
I wish it would be that easy that I could pinpoint one or two places.
Gotcha.
Let me
Okay.
jump in. Matt, if I could jump in there real quick.
Go ahead.
If you'll go back to the data when I was looking at the community spread and how the community spread numbers are higher than our known cases, that means we don't know where it came from.
Got it. Okay, thank you. One more question, Lacey. Of course, yesterday we saw that Amarillo had over 1,000 cases. A lot of those were traced back to their local, to the penitentiary facility that is up there. Catherine, whoever wants to answer this, how are we working and how are the numbers looking at our state prison here? We haven't received many updates, or state prison, of course, our Lubbock County Jail.
Yeah, they do have separate data available on the Texas Department of Criminal Justice data for what's going on in that facility. We do have cases there, and we do work with that medical facility and report those, but I haven't seen a large influx or a large increase in the number of cases coming out of there, both at Mumford Unit and at our local county jail.
All right, thank you.
Thank you, Matt. Now we have Amanda Hampton with the Daily Toreador.
Hi. How is the city handling when it is determined that a business or event is not properly following the guidelines being set?
So, Amanda, we have different teams that address that. Our fire marshal's office, code enforcement. Again, we try to work with those event organizers on the front end to make sure that they have a good plan and that they understand how to implement their plan. In the situation where if somebody sees something that's being conducted in an unsafe manner, or we also periodically check all these when these events are going on, and if there's something that's could be improved, then we help them in that regard. We certainly try to educate before we enforce.
Thank you so much.
Okay, now we go to Olga Guerra with El Editor.
Good afternoon, buenas tardes. I was just wondering, as for the spread, why is it that we can't name these facilities, these businesses, and maybe it would attract attention? I remember at the beginning of this epidemic, we were naming the facilities. especially the nursing homes. I believe that if we were to name these places, people would be more cautious and it would put more attention to it. Is there a reason why we can't be naming these entities?
My perspective with naming them is it's always been, we've named places or events when we've not been able to contact the individuals that were going into that place. So when we were seeing more exposures associated with a retail establishment, we would name that retail establishment. With businesses, they're controlled. We know exactly who's been in and out of the door, so we haven't made those public announcements. As far as the nursing homes, I don't have the names of those facilities in front of me. They do get reported to Texas Health and Human Services, and any outbreak associated with a nursing home is posted.
Okay.
And these are places we're monitoring.
Yeah, all right. The next question is, I know y'all give out permits, Steve, and the county as well. But once the permit is given, should there be some kind of tracing? Would that help? Because not everybody can go to those events, especially the people that give out permits. But if you were to have like some kind of supervision, maybe on behalf of the tracers from the health department, to give a report. Because I mean, you give a permit and you're okay, everybody's doing, but when you get to those events or you're actually in those events, things are totally different than what they got permission to do. So I think that would help. And if that would be possible, I mean, would that go under the tracers?
Well, I'll take that. Olga, first of all, we check on these events after they get their application in, and there's a whole variety of applications or permits and applications associated with these events, but the ones we focused on with our fire marshal's office, as I've mentioned before, LPDs involved in code enforcement, are the ones that fall under the governor's order for approval of outdoor events over 10 people. But a lot of these events are conducted very safely. And you're correct, there's always one or two that don't follow the plans, but I think it would be premature to have contact tracing out there from Catherine's department, because some of these events can conduct themselves safely and there's not any spreads.
I understand. I just wish that we would be able to do a lot more in the community, because when you have people, and this has been echoed throughout the press conference, is that you have some people say it's not serious, don't wear a mask, they make fun of you, peer pressure, bullying. That kind of behavior does not help what we're all trying to do.
You're right, Olga, and I think that's the purpose of our press conference and our message today, is that we've got to stay the course, we've got to get on track, and we need everybody's help. City can't do this all on their own. The public health authority can't do this all on their own. Everybody's got to be on board. We've all got to be on the same team to protect each other.
Thank you. God help us all.
Thank you.
Thanks, Olga.
Okay, and that concludes our press conference this week. Thank you to our panelists, and thank you to our interpreter, and thank you for joining us. All resources on the coronavirus can be found at mylubbock.us/COVID-19. We'll see you in 2 weeks.